This CT penis of a 10-year-old child came for with the history of the nasal obstruction mainly on the right side with a change in the voice and also the mouth breathing. So this is the maxillary sinus on the left side. This is the right side maxillary sinus. Right side maxillary sinus is filled with the soft tissue of HU30. Also there is a soft tissue density noted in the right side osteometal complex, which is reaching anterior up to the middle meatus and posterior up to coena and nasopharynx. Also there is evidence of the hypertrophy of the adenoid cell. So this is the case of the antrochoanal polyp. Here also we can say that this left maxillary sinus is filled with air while the right maxillary sinus is filled with the soft tissue density. This on the left side there is a wide opening of the this maxillary sinus in the meatus, while this side this opening is obliterated by the soft tissue density. Also on this side we can appreciate that osteometal opening is widened. Also there is evidence of the bilateral infiltrate hypertrophy, while this hypertrophy is mainly noted in the right side. This hypertrophy is also causing the obliteration of the right sided, mainly the obstruction of the nasal opening. And this also we can see that this is the frontal sinus, this is the left sided, this is the right sided. Left sided frontal sinus is filled with the air while the right side is filled with the soft tissue density, indicating the sinusitis of the frontal sinus. Also here this is the ethmoidal sinus. Ethmoidal sinus on the left side is well aerated, while on the right side this is a mucosal thickening noted in the anterior and the posterior ethmoidal cell, indicating toward the sinusitis. This arrow indicating toward the sphenoid sinus. On the left side it is well aerated, while on the right side there is a mucosal thickening of the polypedal HU30 on the right side is indicating the sphenoid sinusitis. On the left side we can see that there is a well sphenoethmoidal recess, while on the right side is obliteration of the sphenoethmoidal recess. Also here we can appreciate there the obliteration. There is a well frontoethmoidal recess on the left side, but there is obliteration of frontoethmoidal recess on the right side. So we can conclude this case as a antrochoanal polyp on the left side with the adenoid hypertrophy and left-sided or sorry right-sided frontal sinusitis, ethmoid sinusitis, sphenoid sinusitis with the right-sided antrochoanal polyp.